Do you feel troubled by gas, acidity, bloating, burning in the stomach, and indigestion for months, even years? Do you often feel that even after eating a small amount of food, your stomach feels full, even a small meal starts coming upwards? There is constant burning in the chest. The moment you lie down at night, reflux starts. In the morning, on an empty stomach, there is nausea and a bitter taste in the mouth. And the most important part, you tried gas medications, acidity syrups, home remedies, you felt relief for 2 to 3 days, and then same problem returned. If you feel this way, this is very possible that there has been a tiny bacteria inside your stomach for years, whose name is
H. pylori.
Helicobacter pylori. This is the bacteria that exists in almost half of the world's population, meaning it is possible that in your home, 2 out of 4 people are infected with H. pylori and they still don't know about it. In today's video, we will deeply understand, are your gas, acidity, and digestion problems actually caused by H. pylori infection? Where does this bacteria come from? Which symptoms are dangerous? Which tests are the most accurate? What is the real treatment protocol? Which dietary choices help and which ones damage the stomach? And most importantly, can ignoring H. pylori lead to ulcers or even stomach cancers in the future? If you or anyone in your home has been a patient of stomach issues for years, this is the video, which is a guidebook for you. What is H. pylori? H. pylori is a gram-negative, spiral-shaped stomach bacteria. It is a special type of germ that lives in the inner wall of the stomach or stomach lining and creates chronic inflammation there. In simple words, inside your stomach, it's covered with a soft protective layer like cushioning. H. pylori slowly damages this cushion. The result? Acid starts to feel more intense. The stomach wall becomes sensitive. Even a small raw food causes burning pain and gas within seconds. Some people remain asymptomatic for years, meaning the infection is present but symptoms appear later when gastritis or ulcer has already developed. That is why we often diagnose it late. What are the reasons that H. pylori is so common? Water and hygiene issues, contaminated water, boring hand pump water without filtration, water from hotels, roadside stalls. This bacteria spreads through the oral fecal route, meaning whenever hand washing, toilet hygiene, or water quality is poor, this bacteria sticks extremely fast. Number 2, shared utensils. Same glass, spoon, or plate sharing, especially among children or close contacts within a family. Crowded living conditions. Small houses with huge families, children sleeping together, infection slowly transfers from one person to another. Number 4, street food culture. Highly spicy, oily roadside food acts as an irritant on the weak stomach lining and creates a more favorable environment for H. pylori. So what does H. pylori do inside your stomach? H. pylori has a special enzyme called urease. This urease converts the urea present in the stomach into ammonia. And ammonia helps the bacteria neutralize stomach acid for itself, meaning normal germs die in the stomach acid, but H. pylori creates a protective bubble around itself, and this very bubble damages the stomach lining. Because of this, continuous irritation, superficial gastritis happens, then chronic gastritis comes in, and ulcers happen, a small wound in the stomach or duodenum lining. And in rare cases, the risk of stomach cancer increases. WHO has declared H. pylori as group 1 carcinogen, meaning it is a proven risk factor for stomach cancer. What symptoms shouldn't be ignored? Now, the most practical part is, could my symptoms be due to H. pylori? Common symptoms: upper abdominal pain called epigastric pain, especially after eating, or burning type pain on an empty stomach, bloating or gas, feeling tightness in the stomach even after a little food, needing to loosen belt or clothes, acidity, heartburn, reflux, burning in the chest, food coming upwards, fire-like feeling when laying down at night, or early satiety, like feeling full too quickly, like heaviness after 2 to 3 bites or unable to finish a full meal, nausea, especially morning, empty stomach, frequent burping, bad breath, excess burping, and bad smell from the mouth, and loss of appetite, no desire to eat, slow, gradual weight loss. Important note, these symptoms do not occur only in H. pylori, but if they are repeatedly happening for months or years, then H. pylori infection could be a possibility. Now, red flag symptoms: when to see doctors immediately. If the H. pylori infection has been present for a long time or an ulcer has developed, then dangerous signs may appear, like black stools, which is called melena, stools that looks like tar or coal, vomiting blood, severe sudden stomach pain, rapid weight loss, difficulty eating or swallowing, fatigue or anemia, pale face, weakness, this situation is an emergency because it may be linked to a bleeding ulcer or even stomach cancer. In such conditions, never use self-medication. Immediately visit a hospital or a gastroenterologist. Now, test for H. pylori. Which one is the best? Stool antigen test. A non-invasive test detects H. pylori antigen in the stool sample. Cheap, accurate, accessible, especially for follow-up. Urea breath test. Considered the gold standard test. I ordered that test a lot for my patients. Patient drink a special urea solution. If H. pylori is present, it breaks the urea and creates a specific gas detectable in the breath. Sensitivity and specificity is 90 to 100%. Now, blood antibody test, easy to find, but the problem is antibodies remain positive even after the infection has been treated, meaning someone who had H. pylori months ago may still test positive. That's why blood testing is not recommended for diagnosing active infection. Now, endoscopy and biopsy. For the long-term symptoms, red flag signs, bleeding, weight loss, or suspicion of cancer, a gastroenterologist puts a camera through the mouth and the stomach, and a small tissue sample called biopsy is taken to check for H. pylori and cancerous changes. Now, modern treatment, triple or quadruple therapy. Earlier, simple triple therapy was PPI, which are acid reducers, plus clarithromycin and amoxicillin, which was commonly used. But now, worldwide, clarithromycin resistance has happened. Every active H. pylori infection must be treated because it increases the risk of gastritis, ulcers, and stomach cancers. So the first-line treatment without resistance testing, most cases now recommend bismuth-based quadruple therapy for 14 days. It includes PPIs like omeprazole, esomeprazole, pantoprazole, plus number 2 bismuth, number 3 tetracycline, and 4 metronidazole, which is flagyl. Other options include rifabutin-based triple therapy plus amoxicillin drop therapy. Key points: duration must be minimum 14 days. Correct dosage is important. No missed dosages. Do not stop the course midway, because if you stop early, the bacteria becomes resistant, and next time it becomes more harder to cure. Now, what will you feel during treatment? Most patients experience mild nausea, metallic taste in the mouth, loose stools, mild headaches, or some weakness. These side effects are mostly temporary and end soon after completing the course. Doctors usually advise take medicines after meals, drink plenty of water, use probiotics like yogurt and curd, and to support your gut microflora. If side effects are severe, do not start the medication without contacting your doctor. So why is retesting necessary after treatment? Well, guidelines recommend that around 4 weeks after treatment, a stool antigen test or a urea breath test must be repeated to confirm that the infection is truly gone. Important thing is, before retesting, avoid PPIs, which are acid diffusers like omeprazole, esomeprazole, and pantoprazole, and acid-reducing medications for 2 weeks. Otherwise, false negative results may occur. If the test is still positive, the doctor will prescribe a second-line therapy with different antibiotic combinations or bismuth-based regimens. Now, H. pylori diet guide. Now, the practical part: what to eat and what not to eat. Food to avoid for at least 4 to 6 weeks. Tea, especially on empty stomach, coffee, cola, sodas, energy drinks, very spicy curries, deep-fried snacks, pizza, burgers, heavy cheese, vinegar-based pickles, excess red or green chili, tomato-based sauces, ketchups, smoking cigarettes, and shisha. Smoking damages the stomach lining anyways and slows healing. So food that help, supportive and but not curative, are banana, rice, yogurt, curds, oats, porridge, boiled vegetables, carrot, pumpkins, and soups, chickens, vegetables, clear soups, coconut water, small quantity of honey, ginger, small piece or mild ginger tea. Myths versus fact. Myths: just drink milk, acidity will be cured. Milk can give temporary relief but later causes rebound acid. Myths: herbal powders alone can cure H. pylori. No, it does not. No herbal remedy eradicates the infection. Only proper antibodies can eliminate H. pylori. The proper diet is calm the stomach, reduce the inflammation, and help the medication work effectively. Now, H. pylori and stomach cancer risk. Research clearly shows that long-term H. pylori infection leads to chronic gastritis, atrophic gastritis, and changes in intestinal metaplasia, and eventually increased risk of stomach cancers. WHO has declared H. pylori a class 1 carcinogen, meaning a proven cancer-causing factor. Good news: if this infection is diagnosed early and properly treated, future cancer risk can be significantly reduced. Now, frequently asked questions: is every gas acidity caused by H. pylori? No. But if symptoms repeatedly appear, or if there is a family history of ulcers, gastric cancer, or if medications given only temporary relief, then testing is wise. Number 2, does H. pylori occur only in adults? No, children can get it too, especially those who eat a lot of street food, drink unsafe water, or live in homes someone is already infected. Now, does H. pylori always cause symptoms? No. Many people are asymptomatic carriers but still exist. Can probiotics cure H. pylori? No. They can only support digestion. Eradication requires antibiotics. And number 5, can patients fast during treatment? Well, it depends on the patient's health, medication schedule, and doctor's advice. If you have years of gas, acidity, burning in the stomach, indigestion, and a constant feeling that something is not right in your stomach, and you have relied only on herbal powders, over-the-counter syrups, sodas, and home medications and remedies, this is now the time to take a serious medical step. One simple H. pylori test, the correct treatment course, 14 days of strict compliance, and 4 to 6 weeks of diet discipline can dramatically change years of suffering and prevent future risk. Your stomach is the energy center of your entire body. From here, your immunity is formed, your body gets fuel, your mood, brain, hormones, all are indirectly affected. Do not ignore your stomach by calling it just gas. This small bacteria can affect your quality of life, your productivity, and your future health. If you suspect that H. pylori might be the cause of your symptoms, then consult your nearest qualified doctor or gastroenterologist. In the end, I would simply say H. pylori is a common issue, but ignoring it can cause dangers for your future health. Thank you for watching this video. This is a big step for you, for awareness, and for your health. Take care. Do not ignore your family's stomach health. And if any persistent symptoms appears, consult a doctor right away. This is Dr. Raza, explaining the science behind your health. Take care, stay healthy, and stay informed. If you like the video, like it, subscribe it, and share it. Your better health is my mission. You are watching Dr. Raza Health 360 MD. Goodbye. My name is Dr. Raza. I am a practicing family physician in USA for the past 18 years. I am an American board-certified physician and diplomate of American Board of Family Medicine.